Hello, guys. Welcome to another TGIF episode of the Anti-Pharmacist podcast. And like I said on Monday, today I'll be talking about poisons and antidotes. You see, poisoning is one of the emergencies that happen, especially at home. There are things that are unprepared for, especially for people that have children around. You understand? And either it is deliberate poisoning or accidental poisoning. You should have knowledge about what to do in this case, and that is why I've brought this topic to you so that you will not be left stranded. Poisoning can result to death like as fast as that if one does not take enough care and if you don't know what to do in case of poisoning. So without further ado, let's get right into it. Now, what is poison? Of course, people hear about poison every day and they know that it's an harmful substance. But by definition, poison is any substance. It could be synthetic, it could be natural, that can cause harm or death to whoever it comes in contact with. That is any living organism. And what it does is that it damages living tissues and causes harm to the body. That is, it can cause injury, it can cause death. Alright? And it can be ingested, it can be inhaled, absorbed, or even injected through the skin. Now, to classify poisons, they can be classified into 5 basic categories. There are the corrosive poison, there is irritant, cardiac, neurotic, and the asphyxiant. Okay, so corrosive poisons, they are ones that have deleterious effects, usually on the skin. Examples are strong acids and bases, like caustic soda, for example, like hydrochloric acid, sulfuric acid. Those ones are corrosive poisons. Then there are irritants, those that cause irritation. You see, they can cause irritation, they can cause pain, excessive vomiting. Examples are insecticides, pesticides, lead, venom, like snake venom or scorpion venoms. Those are irritants. Then we have neurotic poisons. Those affect the central nervous system. They could cause CNS depression, leading to hallucinations, leading to loss of coordination and all of that, leading to even respiratory depression in some instances. Example is alcohol. Then we have cardiac poisons, those that cause abnormal heart rates. Examples are tobacco. There's one called digitalis. It's a plant, but the version that is used as drug is digoxin. Alright. Then the asphyxiants, they affect breathing. They replace oxygen in the body, like the carbon monoxide, carbon dioxide. Alright. So those are the 5 classifications of poison, basically. And now, poisons can be solid, can be liquid, or gases. I've talked about how they can be inhaled, ingested, they can be injected into the body. So those are the groupings according to physical state. Alright. Now, poisoning may be intentional. That is the one that people used to commit suicide, or accidental. And this accidental poisoning is especially common in children, which is why those who have potentially harmful substances in their houses, like drugs or other substances, have to be especially careful. Of course, every drug is a potential poison. Therefore, medications usually have labels with "keep out of reach of children" boldly written on them. But based on my earlier classification, medications or drugs are not the only potential poisons that may be around the house. The most common medications that can cause poisoning are painkillers, sedatives and hypnotics, antipsychotics, antidepressants, antihistamines, cardiovascular drugs, alcohols, iron pills, vitamins, and supplements. Then there are common household substances that can also cause poisoning, especially in children, and they are batteries. Because when they are swallowed, especially by a child less than 4 years old, they can lodge in the esophagus, causing burns within 2 hours. And this burn can cause hole and extend to the trachea or the aorta. And the aorta is the largest artery in the body, which transports blood away from the heart to all the tissues, the organs in the body, you know that when this is affected, it's a major problem. So it can lead to death. Then another one that can cause poisoning in children at home is iron pills. Iron, yes, our normal irons that adults take. Children should not take the adult strength of iron pills because it is very dangerous for them to ingest. It can cause them to vomit blood or even pass bloody stool in less than an hour of ingestion. Another household product that causes poisoning commonly in children is cleaning products like bleaches, detergents, those that contain chlorines or antiseptic. It can cause chemical burns on the skin or in the throat. That is, if they pour on the skin, they can cause burns. And if the child should drink them, they can cause burns in the throat, and we don't want that. Another one is nail polish removers. Mothers that paint their nails and do their pedicure, their manicure, you must be careful where you put your nail polish removers because some of these products contain cyanide, which can cause death. Cyanide poisoning is no joke. Then there are hydrocarbons like our gasoline, our petrol, our kerosene. They can cause choking if swallowed because they go into the lungs instead of the stomach and cause difficulty in breathing. That's what we call asphyxiation. So they can cause lung inflammation as well that lead to pneumonia. That's an infection of the lungs. Another product is pesticides and insecticides. Many people use pesticides and insecticides in their houses, and the common ones that are not even advisable to have in the house are those containing aluminum phosphide and DDT. These, I believe, have been banned by health authorities. They are used to kill snakes and insects and pests in the house, but they are very poisonous, and not just to children but to adults as well. They can cause skin irritation. They can be inhaled and cause asphyxiation as well. They can also affect nervous system, making it very hard to breathe. Other substances that can cause poisoning at home are wild mushrooms. Mushrooms grow around the houses, and some are edible while others are not. You must be very careful which kind of mushroom you eat. Of course, alcohol is also very dangerous when swallowed by children. It can cause seizures, coma, and eventual death if not quickly neutralized. It doesn't matter the source of alcohol really. Note that mouthwashes, facial cleansers, and some hair products can have as much alcohol in them as alcoholic beverages. Some creams too, like hemorrhoid cream preparations, anti-itch creams, sunburn relief agents, they can cause seizures when ingested by children or by anybody, and they can cause a condition called methemoglobinemia, which prevents the blood from carrying oxygen to tissues. Now that I've mentioned the common agents that can cause poisoning, let's first look at prevention of poisoning before finally talking about antidotes. The best prevention strategy is proper storage of medicines and other substances. Don't leave things lying around the house and within the reach of your children. Like I said, every medicine will have a label bearing "keep out of reach of children." Alright, any substance at all, you should keep them out of reach of children, because children, they don't know better. It's anything they see. They might want to experiment, they might want to know how it tastes, it might look attractive to them, they might pour it on their skin, so you have to be careful. Alright, have a medicine cupboard at home which you keep your medications, and only adults can access. Let it be out of reach of your children. Another way is keeping things in their original containers. Adults can make mistakes as well. When a substance is not in its original container, they can by mistake pour it into their food or ingest it. It can happen, alright? So keep things in their original container. Don't pour things around. Don't say, okay, you want to keep one, you want to manage it, then you are storing it somewhere. Then you saw a carton of milk, for example. You are pouring your detergent inside it because you want to keep the rest of the detergent. Please let it not be like that, because it can cause accidental poisoning, as they can be mistaken for something else. Also, ensure to label products properly. Even if you do that, put a label on it so that everybody will know what is inside. So don't be quick to remove labels, because most of these products come with labels, and the things on those labels could help for identification and also help prevent accidental poisoning. Now, another preventive measure is to wear protective clothing when using corrosive substances like acid, like bases, like liquid pesticides. All right, you want to clean your house with jig, with Izal, with toilet cleaners. Please wear protective clothing, because some of them may contain corrosive substances, especially when they are concentrated. You want to use IPO, or jig, very concentrated. Please wear protective clothing. Do not let it touch your skin in any way. Also, ensure proper ventilation, especially when using insecticides. Forget odorless. Leave the room or house for a few hours after you spray, okay? And in case of those that use generator or use charcoal pot, please don't put them inside the house. Let them be outside the building, where the carbon monoxide coming out from there can mix with the air. Don't put it inside your house where you are breathing it in. We have heard of stories where a whole family is wiped out because of exhaust from generator. Please let that not be you. It will not be you by God's grace, okay? Then another thing is, don't purchase substances that contain all these banned products. Don't even purchase them. You can educate yourself by checking the content of what you are buying before you actually purchase them. You can Google. In this case, Google is your friend. You can Google the content, see how safe it is to be in your environment. If it's insecticide you are buying, look at the ingredients. Check if they are safe to be inhaled. Do you understand? Now, on to management of poisoning. Let me let you know that not all poisonous substances have antidotes, but the aim of detoxification is to either bind the poison and prevent its further action in damaging the internal organs, or to facilitate the fast ejection or excretion of the poison from the body. Okay, so of course there are specific antidotes and there are general antidotes as well. By general, I mean that they can neutralize more than one poison or substance, not that they can neutralize all substances. I hope you get me. While some antidotes act directly to antagonize the specific poison, others allay the symptoms of the poison, okay? So some examples of specific antidotes are N-acetylcysteine for acetaminophen, that is paracetamol poisoning. There is flumazenil for barbiturates poisoning, like the phenobarbital, alright? There is desferoxamine for iron poisoning. There is sodium bicarbonate for salicylate poisoning, like aspirin. Vitamin K1 is an antidote for warfarin poisoning, and 100% oxygen or hyperbaric oxygen is for carbon monoxide poisoning. There are many other antidotes that are specific for some poisons, alright? But like I said, not all poisons have antidotes. So some poisons have to be flushed out of the system by a method known as gastric lavage, and that can only be done in the hospital. Now, I would like to focus on the more general antidotes here and advise that in case of any poisoning, you may use the general antidote and find your way to the nearest hospital for more specific treatment, where the specific antidote will then be administered. Why? Because the specific antidotes are not common drugs, and they are not usually readily available, not even in most pharmacies. That being said, I would also advise that you make friends with at least one healthcare professional, either a pharmacist, a doctor, a nurse, so that in case of emergency like poisoning, you can call or message them for guidance. And of course, I have given you a heads up. That's why this podcast exists, right? So that even if you don't have any health professional friend, anti-pharmacist is there for you. Let me quickly give you some steps to take in case of poisoning to render a kind of first aid. So if the person is not breathing, perform CPR and get them to the nearest hospital emergency ward ASAP. I've talked about CPR in my episode about first aid and basic life support, so you should check that out. But be careful not to do your CPR carelessly so that you don't endanger the person even more. When you are even doing mouth to mouth, be careful so that you not ingest the poison from their mouth. Alright. Another thing is, if the person inhales the poison, get him or her fresh air right away. Ensure proper ventilation. Remember that airway opening is very important. That's one of the ABCs of first aid, right? Airways. Another step to take is, if the person has poison on the skin now, if the poison poured on the skin, take off any clothing that the poison has touched. Rinse the skin with running water for 15 to 20 minutes straight, non-stop. Okay? And if the poison or irritant is in the eye, for example, rinse also with running water for 15 to 20 minutes. Note that being proactive is very important, especially if the poison was freshly ingested, that is, ingested within a short time before discovery. Do not wait for signs of poisoning before taking action. As soon as you know that this person has ingested, do all these things. But it is important that you stay calm and make sure that you have the container of the causa agent, that is the poison that was ingested, nearby. So, because the label may contain important information. In fact, take the container with you to the hospital. Now, to the general antidotes that you should have. It is called activated charcoal. Every household should actually have a tin or capsules of activated charcoal at least. It can be a lifesaver. It is an inexpensive product and you will definitely find it in most pharmacies. It is usually mostly in powder form that comprises of wood, bamboo, coal, or coconut shells that have been burnt at very high temperature. So this has increased the surface area, especially when it is in powder form, and it enables it to absorb substances onto itself. Okay, it binds them, so it effectively binds substances like acetaminophen, that is paracetamol, aspirin, tricyclic antidepressants, but it is ineffective in heavy metal poisoning. Please note that. So, activated charcoal helps to prevent the poison from being absorbed from the stomach into the body. It is used basically for gastric decontamination. And apart from the medications I just mentioned, the acetaminophen and the likes, it also helps in cases of poisoning by digoxin, that's a cardiotonic, olanzapine, and several other medications. So when you have this at least in your house, you can rest assured that you can give first aid for poisoning of most substances, alright, especially the ones taken by mouth. And now to its usage. Initially, 50 to 100 grams is measured and mixed with just enough quantity of water to enable drinking. 50 grams of activated charcoal should be about 3.5 tablespoons. And this should be done within 1 hour of poisoning to get maximum effect of detoxification. Subsequently, smaller doses of 10 to 25 grams should be taken every 2 to 4 hours for up to 6 hours. The dosage is actually the same in adults and children because it is not absorbed in the body. Now, note that giving activated charcoal doesn't mean you should not take the person to the hospital. It is just to reduce absorption of the poison before its specific antidote is deployed. And like I said earlier, it is not all poisons that respond to activated charcoal. But if the ingestion is minimal, then it may just do. For example now, fluoride poisoning, majorly from toothpaste, does not respond to activated charcoal. But taking milk and oral rehydration salt may just help before you visit the emergency room. Note that, alright? And please keep your toothpaste away from your children. I know that they are sweet, alright? Put it in a place that they can't reach. Before I forget, did you know that food poisoning is also a type of poisoning? And it is caused by injecting food that have been contaminated by bacteria like Salmonella, like Shigella, E. coli, botulinum, and other microorganisms like some fungi, some viruses, due to poor hygiene, or those that have been treated with pesticides. And of course, I talked about mushroom earlier, so it could be harmful food that are even poisons in themselves. Others are not properly cooked, and this could lead to poisoning, alright? So the common symptoms of food poisoning are gastrointestinal disturbance, diarrhea, and vomiting. And the foods most often involved are vegetables. It could be your leafy vegetables, your root vegetables, fruits, nuts, poultry, like your chicken, your eggs, dairy, milk, cheese, pork, grains, beans, like that. They are usually crops and animal products. During handling, during processing, they could get contaminated by all these microorganisms I mentioned earlier, or some other contaminants from the insecticides, some metals, all right, some heavy metals. Food poisoning is common in infants and young children, the elderly, those that have chronic disease conditions, and those that are immunocompromised, all right. It often leads to severe dehydration. That's the major problem. When one has food poisoning, you see that you are vomiting and you are just too lean, watery stool for that matter. That is diarrhea. So it causes electrolyte imbalance, which can lead to irregular heartbeat. In this case, oral rehydration salts or oral rehydration therapy, which we know as ORS or ORT, are used alongside some antibiotics. I mentioned that it is caused by microorganisms, and that is that. Of course, you can take your case of food poisoning to your pharmacist for proper treatment. That is as soon as you notice the symptoms, though. And you know that it can be prevented, right? How? By proper handling of your food, proper storage, and cooking of your food. Eating organic food instead of heavily treated or processed food too will help you. Whew! It's been a lot of information passed on today's episode, right? You know what you can do in order to absorb all of this? Listen more than once. That is just the code. Listen more than once. And of course, you can ask your questions through the available channels, through our mail at antifarmacistpodcast@gmail.com, on LinkedIn, on X and IG, even in the question and answer section under this podcast on Spotify. Okay? You can comment as well. Let me know what you have learned from this. Let me know how this podcast has helped you. And you can share your experience about poisoning with me as well. Let's discuss. Okay? Please subscribe, follow, and share the podcast. Only then can we grow to reach more people who will find this information beneficial. Of course, I appreciate your help and support so far. Thanks for your continued support. I see them and I'm encouraged to do more. Thanks again for listening. Till next time, stay healthy and God bless you.